Supraglottic airway, KingLT. Indications for use for a KingLT include need for ventilatory assistance or airway control, and other airway management procedures have been inadequate, ineffective, or unsuccessful. For this skill, you will need a prepackaged KingLT of an appropriate size for the patient, a 60 cc syringe for inflating the cuffs, water-soluble lubricant, and a means for lubricating and securing the device. Prepare all equipment and test the integrity of the cuffs by inflating and deflating prior to insertion. The cuffs help anchor the tube in the correct position, occlude the esophagus, and stabilize it in place. Note the amount of air required to inflate the cuffs. This information is also found on the side of the tube. Lubricate the tubing, ensuring to avoid the ventilation port on the anterior aspect of the tube. Position the patient with the head in neutral alignment and with slight extension. Using either a cross-finger technique or a modified jaw lift, open the mouth with the non-dominant hand. Insert the KingLT with the other hand while keeping the mouth open. Advance the KingLT until it feels seated in the upper portion of the esophagus and in the oropharynx. Inflate the cuffs to include the esophagus and the oropharynx. This also lifts the epiglottis forward. This will ensure that air moving through the tube exits at the glottic opening and passes into the trachea. Once the cuffs are inflated, attach the filter, end-tidal CO2, and the BVM. Confirm tube placement by ventilating with the BVM. If you don't see chest rise or it is difficult to ventilate, the KingLT is likely inserted too far. Deflate the cuff and withdraw 1 to 2 centimeters, re-inflate and reposition the cuffs, and attempt to ventilate again. The tube is properly positioned when you see equal chest rise, and it is easier to ventilate with the BVM. When tube placement is confirmed, secure the KingLT by whatever means is used in your service. This may include clear tape, pink tape, or a commercially prepared device. The KingLT is available in 5 sizes that correspond to the patient's height. The pediatric sizes are 2.0 and 2.5, while the adult sizes are 3, 4, and 5. The 2.0 KingLT should fit a pediatric patient 35 to 45 inches tall, or approximately 3 to 3.5 feet. This height corresponds with the average 3-year-old. The 5.0 KingLT is intended for patients 6 feet and taller. Sizing information is located on the packaging of the KingLT, the tube itself, and in your paramedic field guide.